What's going on, guys? Today we are going to be talking about Mk-677, also known as Ibutamoren. The reason that we're going to be talking about this is because I had a friend of mine message me the other day and he was like, "Hey, so what do you know about this?" And I was like, "Well, I think I know a lot about it. Ask a more specific question. Is it going to help me put on more lean mass?" I said, "No, absolutely not. That's not what it's for." So I did a little bit of digging, partially so that I could verify what I thought I knew, but also partially so that I could help him out and give him more information on something he had questions about. And after doing some research, I may have to eat my words. All right, so Ibutamoren. Overview of it. Mk-677, also known as Ibutamoren, is a growth hormone secretagogue, which means it stimulates the secretion of growth hormone and insulin-like growth factor 1. It is not a SARM, selective androgen receptor modulator, though it is often mistakenly classified as one due to its common use in bodybuilding and fitness communities. The history of Ibutamoren. So its development. Mk-677 was developed in the 1990s by Merck as a potential treatment for conditions like muscle wasting, osteoporosis, and growth hormone deficiencies. Clinical research. Studies have primarily focused on its ability to increase growth hormone and IGF-1 levels, improve bone density, and enhance muscle growth. Status. While it has shown promise in clinical trials, Mk-677 has not been approved by the FDA for medical use. It remains available as a research chemical in some markets. Benefits. 1. Increase growth hormone and IGF-1 levels. Boost natural production of growth hormone and IGF-1, which are linked to muscle growth, fat loss, and recovery. Enhance muscle growth. May improve lean body mass and muscle retention. Fat loss. Increase metabolic rate, potentially aiding in fat reduction. Improve bone density. Promotes bone health, which is particularly beneficial for aging populations or those at risk for osteoporosis. Better sleep quality. Increases REM sleep, contributing to the better recovery and overall health. Improve skin and hair. Elevated growth hormone levels may improve skin elasticity and promote healthier hair growth. Side effects. Water retention. Swelling in the hands, feet, or joints. Increased appetite, a common side effect due to its interaction with the ghrelin receptors. Carpal tunnel syndrome. Numbness or tingling in the hands due to nerve compression. Insulin sensitivity. Potential for reduced insulin sensitivity, increasing blood sugar levels. Lethargy. Some users report excessive tiredness, especially at higher doses. Potential prolactin increase. Rare, but could lead to side effects like gynecomastia, development in the breast tissue in men. I'm not really sure how a growth hormone secretagogue would have any kind of downstream effects on estradiol, which is what's going to more than likely end up causing something like gynecomastia and upregulated levels of that. So take that with a grain of salt. And again, it said rare anyways, but yeah, more you know, I guess, or more information you get. I'm not sure if I would consider that knowing something. Unknown long-term effects. Since long-term studies are lacking, the risks of prolonged use are unclear. Dosing protocols for Ibutamoren. 10 to 25 milligrams per day is the most commonly used range. Higher doses, 25 milligrams plus, may increase side effects without significantly enhancing the benefits. So in theory, going above 25 milligrams a day is going to do a lot more harm than it is good. You hit roughly diminishing returns around there. Taken once a day, typically before bed, to align with the body's natural growth hormone release during sleep. Cycle length and stacking. Cycles typically last 8 to 12 weeks, but some users opt for continuous use due to the relatively mild side effects of Ibutamoren. Often combined with SARMs or other performance-enhancing compounds to maximize results. Important considerations. Medical supervision. Always consult a healthcare professional before starting Mk-677, especially if you have pre-existing conditions like diabetes or metabolic disorders. Legality. Mk-677 is not FDA approved and may be restricted in certain countries. Quality. If purchasing as a research chemical, ensure the source is reputable and to avoid counterfeit products. Diminishing returns of Ibutamoren. So, mechanism behind diminishing returns. Desensitization of the receptors. Mk-677 works by mimicking the hormone ghrelin and binding to its receptors, which stimulates growth hormone release. Over time, these receptors may become less responsive to stimulation, leading to reduced efficacy. Saturation of growth hormone levels. The body has optimal range for growth hormone and IGF-1 levels. After several months, growth hormone and IGF-1 may plateau, and additional stimulation from Mk-677 may no longer yield significant benefits. Adaptation of the physiological systems. The body adapts to elevated growth hormone and IGF-1 levels, which might reduce the anabolic or lipolytic effects over time. Insulin resistance. Prolonged use may increase insulin resistance, which could counteract with the metabolic and muscle building benefits. Signs of diminishing returns. Slow or stalled progress in muscle gain or fat loss, reduced improvements in sleep quality, plateau in strength gains or performance, noticeable side effects like water retention, insulin resistance without additional benefits. How to mitigate diminishing returns. Take breaks, cycling it. Use Mk-677 for 3 to 6 months, followed by a break of 4 to 8 weeks to reset receptor sensitivity and hormone levels. Lower the dosage. After achieving initial results, some users reduce the dose to 10 to 15 milligrams daily for maintenance, which can prolong effectiveness and reduce side effects. Monitor your IGF-1 levels. Regular blood tests can help determine when IGF-1 levels plateau, indicating the need for a break or adjustment. Optimize supporting factors. Ensure proper nutrition, sleep, and training to maximize benefits from elevated growth hormone and IGF-1 levels, combined with other compounds. Mk-677 may be stacked with SARMs or other performance enhancers to maintain progress during extended cycles. Clinical studies on Ibutamoren. Study Murphy MG ETAL in 1998. Objective: evaluate the growth hormone releasing effect of Mk-677. Participants: 32 healthy elderly adults, ages between 65 and 80. Results: daily doses of Mk-677 increase serum growth hormone levels by 40 to 90%. IGF-1 levels increased by 60% after 2 weeks and sustained 72% after 1 year. No significant safety concerns were reported over 12 months. Conclusion: Mk-677 effectively elevates growth hormone and IGF-1 levels in older adults, suggesting anti-aging and muscle-preserving potential. Effects on muscle mass and body composition. Study Chapman IM ETAL 1997. Objective: investigate the impact of Mk-677 on muscle mass and fat-free mass. Participants: 24 healthy, young, and elderly men. Results: 25 milligrams a day of Mk-677 increased fat-free mass by an average of 1.6 kilograms over 8 weeks. Muscle protein synthesis markers improved. Increased appetite due to ghrelin mimetic effects. Conclusion: Mk-677 enhances lean body mass and may counteract age-related muscle loss. Catabolism and muscle wasting. Study Svensson J. ETAL 1998. Objective: investigate Mk-677's role in preventing muscle wasting during caloric restriction. Participants: healthy volunteers undergoing caloric deficit. Results: Mk-677 preserved nitrogen balance and muscle mass during caloric restriction. Improved markers of protein metabolism. Conclusion: Mk-677 has anti-catabolic properties that may be useful for patients during muscle wasting conditions. Insulin sensitivity and glucose metabolism. Study Alibi SMH ETAL 2006. Objective: assess Mk-677's impact on glucose and insulin. Participants: elderly adults. Results: IGF-1 and growth hormone levels increased, but mild reductions in insulin sensitivity were observed. Fasting glucose levels remained stable in participants. Conclusion: while Mk-677 increases growth hormone and IGF-1 in its long-term effects on glucose metabolism require further investigation. Key findings across all studies: growth hormone and IGF-1, reliable increases in growth hormone and IGF-1 levels across various age groups. Muscle and bone. Improves lean mass, muscle strength, and bone density, particularly in aging populations. Sleep. Enhances REM sleep and overall sleep quality. Side effects. Generally well tolerated, but may cause mild insulin resistance, water retention, and increased appetite. So, in conclusion, I might not have been completely accurate when telling my friend, like, oh yeah, no, Mk-677, Ibutamoren, does not increase muscle mass at all. It doesn't help with any of that stuff. Based on the abstracts from the studies that I read off previously, that seems to not be the case. Bear in mind, these are just the abstracts. I do not have access to PubMed. I am not a doctor, and this is for educational and entertainment purposes only. Please consult your doctor before doing any of this kind of stuff, and if you're purchasing it via research chemical, please make sure that whoever you're getting it through is going to be someone that's not putting a bunch of heavy metals or other things in it that are not supposed to be in there, or diluting it to where you're not getting everything that you're supposed to be getting out of it.